It wasn't that many years ago that Buckeye was a community of 5,000, and today we're 60,000. So 55,000 of those people came from somewhere else. And unfortunately, many times they've left their support systems where they came from. And so when you do that, now you're in a strange place with strange people and you don't have that support system. Our program begins with a referral from the hospital. The discharge staff makes the determination on who we're going to deal with. It's a voluntary program by the individual once they agree to do it. That information's forwarded, we then process them into the system, and then we go visit them.
It's basically hospital trying to reduce hospital readmissions is really what the goal is. But the primary objective is really to help we saw a gap in our community, people that weren't being serviced or helped. Once we're out there, we start with the safety review of their house. We want to make sure the environment's safe for them. After that, we look at what we were called for. And we start off a lot of times with, did you understand your discharge instructions? Have you got your medications? Do you understand that you have to go see a doctor? Have you made that appointment? And then after that, it's a follow-up process. And that could be anything from vital signs to weighing the patient, checking blood pressures, checking blood glucose, encouraging them to lose some weight, encouraging whatever it is based on the reason that we were there for them.
I think it's a lot cheaper to send out a couple paramedics to somebody's house who just needs a check-in and a conduit to the doctor, as opposed to sending a full-on fire apparatus, sirens blaring, out to see somebody. It seems like it's a much better approach to catch them in a calm, stable environment before the emergency happens and before we're having to haul people back to a hospital in an ambulance.
Well, I went over to Fry's family clinic because I thought I was suffering from some kind of flu. Mark is the doctor over there. He says, you need to go to the hospital. They didn't realize they had pneumonia yet, but they knew something was wrong because I wasn't breathing right, you know. Well, a few days later, you know, they said, would you like some help at home? And so I got all kinds of help. They're very friendly and they don't scare you at all. I have AFib. My heart doctor had done several other tests and never was picked up, even the mighty CAT scan. And so I was, you know, thinking, geez, that little tiny camera that the fireman used picked it up on one of these little pictures here. It saved my life.
We're here to support the person in whatever way we can do it. And again, the goal is to take a bad day for them and make it the best we possibly can.
Well, we've gotten a lot of positive feedback on it. It's something that's really impacted the community really well. I mean, it's done really well and people are really happy about it.
I'm very, very blessed. I have a wonderful council, great managers, great mayor, and they support me in allowing me to do some of these things.
We are so thankful for the men and women that are in our fire department, the staff that supports them, and for the chief for ideas like this. The healthier the community, the better off the city of Buckeye is.